the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. Today we're joined by Dr. Silene St. Dr. St. Bernard is a VCA Regional Medical Director for Southern California and also a Diplomate of the American College of Veterinary Preventive Medicine. Welcome, Silene.
Thank you. Thanks for allowing me to participate. I'm excited.
I'd like to start off with hearing your career journey and how did you become a veterinarian and how did you get to where you are now?
It is a long and winding road. So
as it usually is.
I will try and make it a reasonable story. So I'm probably a typical veterinarian, and then I wanted to do it ever since I was a child, but I didn't get there right away. So I did an undergraduate degree in zoology, worked on a master's program in biomedical engineering that I didn't complete, and then went off to work in marketing and business for a few years. And so I was not really happy in business. And I finally talked to somebody and they're like, well, what have you always wanted to do? And I said, well, I always wanted to be a vet. Well, why didn't you do that? And I said, well, I didn't think I could. I think I'm too old. They're like, how old are you? Like 28 years old, which at the time felt really old to go to vet school. So I took their advice. I got into vet school, and then coming out of vet school, went straight into emergency medicine. I practiced emergency for a while, and then I designed and built a small animal practice, which I ran for a couple of years, and then sold it and went back to ER practice. After those first few years in practice, I had some medical issues and had to take a bit of a career turn, and I ended up going to work in industry, in the pharmaceutical industry, as a field veterinarian, and I worked for Bayer as a field vet for a few years, and then went into their headquarters and got to work a little bit with regulatory medicine, drug development, and things like that, which was pretty interesting. Worked a little bit in marketing as well with product development and getting new products to market and things like that. And then went from there back into the field for some other companies. So I worked for both Novartis and Elanco Animal Health as a field veterinarian as well, teaching, training. It was really a great experience and a good role. I got to meet so many different people and so many different veterinarians in that role. Little bit of time in there. I also worked in the pet insurance industry. So for about a year and a half, I worked in pet insurance. But again, everything you do provides you information for the next role you're in. So I learned a lot in that role, and it's really helped me in other roles I've had. And then about 5 years ago now, I decided to get board certified in preventive medicine, which I know we'll talk about a little bit. And once I did that, I thought I wanted to use that information and use that resource a little bit more. And I decided to look around, and the opportunity with VCA came up as an RMD. So I joined VCA right at the beginning of 2020, coincidentally, right when COVID started. So got to put my knowledge to use right off the bat.
Silene, you mentioned that you are a Diplomate of the American College of Veterinary Preventive Medicine. And I bet that there's a lot of listeners who've never heard of that credential and aren't familiar with it. Could you tell us a little bit about why you decided to go that direction, and where do people with this credential work in veterinary medicine?
Yeah, those are a lot of really good questions. So I'll start with the American College of Veterinary Preventive Medicine. It actually began in about 1950. It's a pretty old college in terms of specialty colleges for vet med. And basically the focus originally was public health. It still is public health, but we're dedicated to improving the health of animals, humans, and the environment, which may sound remarkably similar to One Health, which is exactly what it is. So there's actually a board certification in preventative medicine, and there's a subspecialty in epidemiology as well. We basically address detection, prevention, and control of diseases affecting food, animals, and humans. So it's a broad specialty. The specialty itself, there are two pathways to get board certified. So one is a more traditional residency program. There aren't very many. I believe there are 3 now because we just approved a new one at Mississippi State. The majority of folks that are certified, though, do it on their own. So it is a long course of study. It's not a clinical specialty per se, so we're not in clinics. This is really population health. So it's just a lot of studying, learning, and then a 2-day long exam for the board certification process. You asked a question about what people do. So the 5 areas that it covers is environmental health and toxicology, epidemiology and biostatistics, food protection, which includes food security, food safety as well, infectious and parasitic diseases, and then public health administration and education. So it's a broad specialty versus some of the others, which are a little more deep. Folks with this certification will work all across medicine. So you'll find them doing research. You'll find them out in the field. You'll find them investigating disease outbreaks. They work in food safety. They work in the military. They work at the CDC. They work at the USDA. They work as federal veterinarians, as state veterinarians, as local veterinarians. And some of them work in practice. They work in shelters. So there's lots of areas of opportunity with this specialty.
It sounds like with the population medicine aspects, this would lean a little bit heavily toward perhaps people involved in food animal medicine and care. Do you have an idea of the split of small animal versus large animal people in the specialty?
It's a good question. And I think it's probably going to be hard to pare down. So there definitely are a lot of large animal folks that are involved. But if you think about outbreaks, I mean, we recently in Southern California had an outbreak of canine flu virus. And so that's a small animal outbreak. And we had multiple folks from our board working on the outbreak and how do we manage it and how do we get it under control. And there are folks working at the state level, folks working at the local level, as well as us in a little bit closer to more traditional practice. So it really applies across the board. And if we talk about diseases that transmit back and forth between people and animals, like zoonotic disease, companion animals are part of that as well. So,
yeah, it is really interesting to think, and I think, again, it's a point that we learn in vet school that more of the public health aspects tend to be more toward large animal. Obviously, that's not true at all for all of the reasons that you mentioned. Silene, you mentioned a comment, One Health. Tell me a little bit more about what that means.
Sure. We are using the term One Health a lot right now, and you hear it a lot in the news. People may not be clear as to what it means. It's actually pretty simple in concept. I would call it simple in concept and broad in impact. So basically, it means that we are all connected. So human health, animal health, and the health of our environment, plants, everything, we're all connected. And I would sort of give a really simple example of something like water. All of the things we just talked about require water to be clean for healthy life. So if we have a problem with our water supply, it impacts everything. It impacts the animals, it impacts the people, and it impacts the environment. That's an easy example, but it also, becomes more detailed when we start thinking about diseases and parasites and things that impact us broadly. And we can have an impact on the whole world in each of these areas as we focus on their care.
You also mentioned, I think in earlier comments, something about the canine influenza outbreak that happened recently. And let's just walk through that outbreak and what happened and the progression through it and response to it.
Sure. So we started seeing cases summer of last year, so summer of 2021. We are lucky in Los Angeles specifically because we have a veterinary public health department specifically in Los Angeles, which is pretty rare to have a city public health department that's veterinary focused on companion animal medicine.
Wow.
Most of our state,
very rare.
Very rare. They track things like this. Their larger focus is zoonotic disease, to be honest, things like rabies and leptospirosis, which we also had an outbreak of. But they still focus on companion animal outbreaks. And so they started seeing the information. We started seeing it in our hospitals. There appeared to be patients that were sicker than we were used to seeing with CIV, canine influenza. And we hadn't had much canine influenza here in the past. So we had a few cases over the years the disease has been known, but we've never really had what we would call an outbreak. And that changed significantly last summer. We had a few thousand cases, probably, when you added it all up between all the counties here, which is a lot for us. So we started looking at, where was the disease centered? How do we track it? How do we get testing done so we can treat patients properly? How do we stop the outbreak? And that had a lot to do with, if patients are coughing and not that sick, we don't let them in the hospital. We treat them as outpatients, managing our patient flow. So we went through all of that, teaching and training our teams. How do we properly handle disinfection in the hospitals? If we do have cases, how do we isolate the really sick ones? And then also providing information to the public, to our clients, so that they knew what was going on, so that they were aware of what to look out for, that they understood they had to keep their, pets or dogs specifically out of kennels for a while, and until we could get the outbreak under control.
And about how long did the outbreak last?
I believe the first cases were noted somewhere in the neighborhood of July of 2021. And essentially by the end of December, beginning of January, the outbreak was considered closed.
For those who might be listening who aren't really familiar with canine influenza, how does that compare to human influenza? And how would a pet owner protect their pet?
I'm going to say it's, all things considered, relatively similar. It is a flu virus, and we have lots of different kinds of flu viruses. The good news about canine influenza, at least in terms of the human piece, is that it's not zoonotic, which means that humans and other animals and species other than canids don't get it, for the most part. So we can't pass it between animals and humans. Dogs get similar signs. They're going to be coughing. They may have respiratory signs. They're going to be lethargic. They may not feel well. They may not eat. The really sick ones can end up with a pneumonia, which is similar to what can happen with humans. And certainly if the dog has some other immunosuppressive disease, they're going to be more at risk. And again, very similar to what would happen on the human side. But most of them will get better on their own. It's a virus, so antibiotics are not something we would treat them with. That's always a very difficult discussion to have with owners. And honestly, with doctors, because without a test, we don't necessarily know. So sometimes we'll try and treat with something we don't need. But generally, it's supportive care, keeping them isolated so they don't get any other dogs sick, and letting them recover at home. And then obviously, if they're sicker, they end up in the hospital, and we treat them as we would treat any other sick respiratory patient with oxygen. There is a vaccine to protect against this disease. So we went on a pretty large vaccine recommendation program at that same time and vaccinated across all of Southern California, thousands and thousands of animals. So that was actually excellent that we got people to realize how important the vaccine was to prevent the disease.
Yeah, absolutely. And, certainly I think also similar to human flu, part of the problem is that animals that have it, dogs that have it, start to shed the virus before they're sick. So it helps to explain why it can spread so quickly and why an outbreak can become as bad as it is. Talk to me a little bit about how can we make sure that we're using antimicrobials, antibiotics correctly, and about your interest and work in that area and what's happening at the VCA and the Mars veterinary health level.
Sure. So antimicrobial stewardship really is the idea that we should be using antibiotics and other drugs that kill different kinds of bugs correctly. And by correctly, I will rely on what I call the 4D principle, which means we should be using the right drug for the right disease, the right dose, and for the right duration of time. Those are the four things we really want to look at. And what we find is that probably the biggest mismatch and the biggest place we see, I'm not going to call them mistakes, but the biggest place we see challenges for folks is the is the drug disease matchup. So we have a lot of illnesses that we may not know for sure whether there's a bacteria or not. And so a lot of times animals will just get prescribed an antibiotic when they really don't need it. That really can cause problems down the road. If we are prescribing antimicrobials, they are not benign. They impact every organism that naturally lives in your body. And so if we're prescribing something that isn't needed to treat a disease, we're putting at risk the patient for a future disease they may get that now we may not be able to treat because we may be creating resistant bacteria in their system down the road. So the idea is that we want to do a better job of identifying specific bacteria and specific diseases and treating those appropriately. So our canine influenza is a really good example of that. It's a flu, it's a virus. Antibiotics don't treat viruses. So unless there is a co-infection, meaning there's also a bacteria as part of that patient's disease process, and you need a test to determine that, we don't need to treat them with antibiotics. And if we do, and we treat them because these dogs can be coughing for a while, if we start treating an animal for 3 or 4 weeks with antibiotics that they don't need, we potentially can impact them again for issues down the road.
It seems like a daunting process to think about all of veterinary medicine. So let's kind of focus a little bit on the small animal piece and how we're working within VCA and Mars Veterinary Health to address that and make sure that people are using antimicrobials the correct way.
Sure. I think there are a whole lot of things that we can do. A large part of it is just providing information and education to the doctors and also to our clients.
Right.
So we start by providing information on the drugs themselves. What are the right drugs for the right diseases? What are the right drugs for the right bacteria? What are the appropriate doses? So we have all that information at hand. And we have some new apps and things that we can use to identify those, which is really helpful. And then we start looking at other ways to measure and to talk about things. So examples like if we have a patient that has an illness, and there are many that don't need antimicrobials. Another example would be a cat with a urinary issue. Most of our cats with urinary issues don't have bacterial infection, but it kind of looks the same as a urinary tract infection.
Mm-hmm.
So
yeah,
people,
absolutely.
right? And so people tend to want to treat with antibiotics. So if we can teach people that's not the right treatment, these are the other treatments that you would provide relief, that you need to provide relief for these cats, then we can get away from using the drugs that really aren't working anyway, because they're not treating something that the patient has. So it's a combination of education, of tracking, what people are doing, of providing resources to the teams, even things like handouts that explain to a client why we're not giving antibiotics and why they're not indicated. It's honestly similar. I remember when my child was young, going into a pediatrician's office and seeing signs on the door that said, we don't give antibiotics out for sneezes or for colds. And that was a part of their campaign to teach me as a parent that an antibiotic wasn't the answer to a cold. And so I think we need to be doing similar things in vet med.
Well, they're such life-saving drugs when they're used appropriately, and it is really scary the amount of bacterial resistance that's developing, and as a result of inappropriate use. The bacteria they're always smarter. They're always smarter than we are, and they will be here long after we're gone, I'm sure. You mentioned a little bit earlier the term zoonotic, so I want you to explain what that is again, if we have listeners who are not sure. And the importance of preventive care. And we talk about prevention a lot in veterinary medicine, but what does that look like and how do we use that for animal health and human health?
So zoonotic disease is an illness of some kind or another that passes from animals to humans. And it can be a kind of a short-term thing. In other words, if we think about COVID, which we probably don't want to at this point, but if we do, we know that disease at its origin passed from animals to people. We're not sure how, probably from bats, and then propagated in humans thereafter. And we didn't see continuing transmission from animals to people, but that was the origin of it. There are diseases that much more routinely pass back and forth, both zoonotic from animals to people and reverse from people to animals. Some of the scarier ones are things like rabies. So we vaccinate dogs and cats for rabies because it's a fatal disease without treatment. And so we want to eliminate it. And by making sure we vaccinate and prevent it in our dogs and cats who live so closely with us and sleep with us, cuddle with us, it makes it much safer for us to ensure that we're not at risk of getting that from our pets. I have a little story that I think really explains why prevention is so important. I'm the chair of the Board of Health and Human Services for the city of Long Beach, where I live in California. And I got a call one day from our public health officer, who's the doctor that is in charge of the the health department here in the city. And they had a group of residents living in a building that was, and the building wasn't being properly cared for. And there were a lot of rats. And several of the children had come down with typhus. And typhus is an illness that is passed from fleas to people and makes them sick. So they went into the building, obviously had some discussions with the landlord to get the place cleaned up. But several of these folks, and this is a low-income housing area, they had dogs. And we don't want the children to lose their dogs. And the fleas, even though they were mostly on the rats, they're obviously also going to be carried around on the dogs. And so they needed flea control for the dogs that we could provide from the city. So I worked with the health department to identify the best flea prevention, considering the lifestyle and situation that they were in. And we got that set up and got flea prevention for the dogs so that the dogs would stay healthy, the people would stay healthy, and the children could keep their pets at home. So that's kind of a broad picture of what One Health looks like, and how we use prevention to prevent zoonotic disease.
I love that you touch on the human-animal bond and emotional aspect of the dogs really helping those families and being members of those families as well. We've talked a little bit about serious diseases we vaccinate for, such as rabies. And I love also the parasite discussion that diseases can even be passed from common parasites, fleas, ticks included. So what about worms? What about intestinal parasites? Are we at any risk from those?
So unfortunately, dogs and cats still carry a lot of intestinal parasites. There are some geographic variations, so it depends a little bit on where you live in the world as to what parasites are most common in different animals. But there are some that are consistently present, especially in our dogs and cats. And probably the two most common are roundworms and hookworms, both of which are zoonotic. So people can get sick from both of those parasites. We most likely see it in younger folks, children, because they tend to not wash their hands. They roll around on the ground. They lick their fingers. They play in the dirt and whatnot. But they are zoonotic parasites. So it is recommended that, and this is one of the reasons that veterinarians recommend routine parasite control. So we recommend monthly or quarterly deworming for all of our dog and cat patients to try and keep their worm burden down. Again, because dogs and cats walk around in the environment, especially cats that are outdoors. And then most dogs are going outside to go to the restroom. So they're walking around on the ground. They pick things up on their feet. Usually it's eggs of some of the parasites. Sometimes it's the larva. And then they lick their feet to clean themselves and re-ingest the parasite and continue the cycle. So deworming them routinely on a planned schedule. And again, usually they're monthly products of some kind, just to be consistent. It kind of helps to ensure that they're not carrying parasites that are going to impact humans.
Well, and it's interesting. We have some better diagnostic tests now that I'm really looking forward to seeing the results. Because I agree with you. I think that the testing we've been able to see, when you have a positive, it's a positive. When it's negative, it might still be positive. So I'm really excited about some of the new PCR diagnostics for evaluating for intestinal parasites in dogs and cats. So that's very exciting as well. I think that we are nearing the end of our time. If you were talking to, let's say, an earlier mid-career veterinarian, what would your advice be to someone who's out there and maybe they're wondering, well, what's next, or what's the next thing I'm looking toward?
Yeah, I think that's a great question. I know for me that going through vet school and becoming a veterinarian gave me something that not a lot of other things could have. And what it gave me was job security. As a veterinarian, you will always have a job. The question about what job that is really up to you. Mm-hmm. There are so many opportunities that I think people just don't realize that are out there. There's so many things you can do. And we mentioned it earlier a little bit. There are lots of jobs that you don't need board certification for. Mm-hmm. And you can teach at a tech school, or potentially even at some of the vet school programs. You can always stay in clinical medicine if you want to, but even in clinical medicine, there are things you can do. You know, you can become a medical director. You could become a hospital manager if you prefer the business side. You can run practices. You can work on the corporate side. So in a company like VCA, we have veterinarians handling acquisitions. We have veterinarians working in recruiting. Mm-hmm. We have veterinarians working in training and knowledge and development. Veterinarians work at we mentioned this earlier, all kinds of different government entities hire veterinarians. You can work for for APHIS, you can work for the USDA, you can work for the CDC, you can work for drug companies, food companies, in public health. There are a million different things you can do. It's about kind of talking to people. And I would provide sort of a resource a bit too. So there's an organization called the American Association of Industry Veterinarians, AAIV. Wow. And they're an allied organization of the AVMA, the American Veterinary Medical Association, just like most of the boards are. And they have an amazing group of people. They have all kinds of resources, webinars, information on career paths. They actually have some they're working with Kansas State. There are master's programs available that are more on the business side. So they have a lot of things available through the AAIV as well, if you're looking to expand your horizons outside of traditional clinical practice.
Well, thank you so much. Every time we talk, I learn new things, and I know that our listeners really will appreciate you sharing your knowledge and experience as well. So thank you so much.
Thanks, Dr. Kerl.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.